Hi, I'm a program coordinator with the Upper Midwest Telehealth Resource Center, a program of the Indiana Rural Health Association. And today we're going to be going over some updates related to telehealth coverage in the region for the second quarter of 2023. We'll be covering the basics of Illinois Medicaid, updates to Illinois Medicaid, as well as some pending legislation in Illinois for March of 2023. If you have questions related to the contents of this video, please feel free to reach out to us at info@umtrc.org. First, we'll touch on some of the basics of Illinois Medicaid. Illinois Medicaid is housed under the Illinois Department of Healthcare and Family Services. Some of the offerings include the All Kids and Family Care programs. Due to the upcoming end of the federal public health emergency, federal legislation has dictated an end to automatic enrollment, and certain eligibility considerations changed due to the COVID-19 public health emergency. Medicaid beneficiaries will have to renew their coverage this year, starting in June, with renewal notices being sent out in May, as Illinois resumes Medicaid eligibility redeterminations to comply with federal legislation. Beneficiaries can check their renewal at the website on screen. Illinois released a provider notice in April regarding prior approval requirements that will resume at the end of the COVID-19 public health emergency, so May 11th. Temporary changes will no longer be in effect after the end of the public health emergency, and all prior approval requests will require clinical justification and a valid practitioner order. Some highlights in this notice include the following. So HFS provider notices dated April 6, 2020 and May 18, 2020 informed providers of temporary changes in PA requirements intended to promote social distancing, reduce barriers to participant access to services, and to ease the administrative burden on providers during the public health emergency. These temporary changes will no longer be in effect at the end of the PHE, and all PA requests will require clinical justification as well as a valid practitioner order. Some impacted services include therapy and the CPT codes listed on screen now, as well as home health and durable medical equipment, or DME. And you can see the bulletin for more information and for the exact codes being affected. So as of now, no specific guidance or bulletin has been provided around Illinois Medicaid related to telehealth following the end of the PHE. You can see the CMS bulletins and guidance for more information, and if there's any more information from Illinois specific to telehealth at the end of the public health emergency, we will provide more information on that as it becomes available. So the largest private insurer in Illinois is Anthem Blue Cross Blue Shield. Any questions about private insurer coverage after the PHE related to telehealth should be directed to the insurer directly, as answers will vary depending on the state, the type of coverage, and the service being discussed. So a bill to be aware of that was recently enacted in Illinois is House Bill 4797, which allows for a short-term visitor to Illinois to continue telehealth services with their home state therapist as long as certain requirements are met. These requirements include the following. So they must have a pre-existing relationship with their therapist. They can't be a new patient. Their therapist is licensed to practice social work in their home state, and they cap the total sessions allowed in a year to 15 sessions with no more than 5 sessions occurring in any 1 month. So this bill also allows for college students specifically to continue to see their social worker from their home state so long as they have a pre-existing therapeutic relationship with that social worker, and that the student is currently enrolled in an Illinois college or university. So for example, if a student from Ohio is going to an Illinois university, they can still see their home state therapist as long as that therapist is licensed within their home state and they're enrolled in school. So there are numerous pieces of pending legislation surrounding telehealth in Illinois. A full list of these pieces of legislation that are pending can be found on the Center for Connected Health Policies legislation tracker. A few that have been either introduced or have had movement recently are listed here. So SB 1721, among other things, This bill would require a patient 17 and under to be examined in person before a hearing aid can be prescribed, but would allow patients 18 and older to be evaluated via telehealth to receive a prescription for a hearing aid. So SB 1585 would amend the Telehealth Act to include athletic trainer in the definition of healthcare provider. So that's an expanded definition. So HB 3721, this bill would create the Naturopathic Medical Practice Act and would provide, among other things, a definition of telehealth or telepractice, and note that licensees would not be prohibited from using technology to provide services. And then lastly, HB 3960, this bill would apply the requirements around telehealth found in the Insurance Act, also applicable to the state Medicaid program. So a few events occurring in Illinois coming up. So the Illinois Rural Health Association Conference will be this August 9th and 10th. The Illinois Primary Healthcare Association's annual conference will be October 4th and through the 6th. And then SIU's School of Medicine's second annual telehealth conference will occur August 30th, and that event will be both hybrid and in person, so online and in person. So this year, the UMTRC will be sponsoring a track at the Indiana Rural Health Association's annual conference in June on the 13th and 14th. So please feel free to register today to connect with other telehealth professionals and to see some really great presentations around trending telehealth topics, including remote patient monitoring and artificial intelligence. And those are only two topics. We do have more. So you can visit our website at umtrc.org for more information, or feel free to reach out to us and let us know if you have questions. So if you have any more questions related to this presentation or to telehealth in general, please do feel free to reach out to us via email at info@umtrc.org or at any of the avenues listed on screen now. Feel free to connect with us on social media as well to stay connected and updated for all of the latest in telehealth news and updates. Thank you for your attention during this video today. We appreciate it.